Hello and welcome to another webinar by Generation Care. My name is Malcolm Choate. I'm the CEO of Generation Care. Generation Care is one of a number of services powered by the Better Health Generation. Generation Care is a specialised service that provides care and support and other allied health interventions for older people. This is a series of webinars that we're presenting. The topic of today's webinar is the future of telehealth in the care of older people. The topic is, I think, very relevant for today's circumstances for some very obvious reasons to do with COVID. And yes, I will be talking about COVID today. But it's also, I think, just a very topical area generally for reasons that I will explain. By way of introduction, I am a psychologist, and that fact may come across in some of the things that I'm saying today and some of the comments that I make, but I would not want anyone to think that Generation Care is a service that's limited to psychological care. Yes, we do provide psychological help and assistance for older people, but we're also able to provide, and we do provide, other allied health assistance to do with people's physical health and well-being. We are an organisation made up not only of psychologists but also physiotherapists, occupational therapists, speech pathologists, nutritionists, and the like. Just by way of general introduction, over the past few years, when I say few, I mean 10, perhaps 20 years, there have been significant changes in technology. And there is absolutely no doubt that those technological advances, those changes, have brought about changes in healthcare generally. But in particular, they've also brought about the change, or at least potential change, in the way in which older people can be provided with healthcare and support. And what we'll be doing today is looking at the use, in particular, of telehealth as one subset of that technological change. Looking at that and how it fits into the technological landscape, and also, as best as one can, looking at what the future may hold. I'll make this comment now about the future, and that is, when we're speaking about the future in terms of technology, it's really only the immediate future. Who knows what the longer term future looks like? We really don't know. When I think back over the years, as I can, and as I do from time to time, I'm just amazed at what it is that we are doing now compared with what it was like when I first became a professional person. And if I extrapolate that forward, who knows what we'll be doing in 20, 30, 40, 50 years. So in particular, what is it that we're going to be talking about today? We're going to be talking about telehealth, what it is, or at least the way in which I define it. And why use it? Why should we be using telehealth? Yes, as I said before, I will be mentioning COVID and the changes that COVID has brought about. And then I'll be talking about some options for the future, looking at what the near future may hold. Essentially, one point I'm going to be making is this. Telehealth and technology generally, but in particular telehealth, is there to enhance services. It may even be there to provide a service that would not otherwise be there. But it's never going to fully replace face-to-face services. I don't think we'll ever come to that stage. I think there always will be the need for face-to-face servicing by allied health professionals, support workers, carers, and health professionals generally. Um, it's an enhancement. It's not going to be a replacement. But before I go much further, I really need to define what it is I'm talking about. What is telehealth? This is just my definition, by the way, but it's consistent with what the research would say as well, what studies would say. So for the purposes of the discussion today, the webinar today, I'm going to be using the expression or the word telehealth to describe any platform, technology-based platform that supports the provision of care. But in particular, a platform that supports a clinician or someone providing direct care for someone else. It includes telephone support, telephone care. These days, it also includes this type of audio-visual technology, what we're doing now. But it's synchronous and not asynchronous. And what I mean by that is that it's care that's being provided to someone using technology right now so that the person receiving the care and the care provider, both of them are communicating with each other there and then, in the moment, to use that expression, via technology. So, for instance, telehealth does not necessarily, in my view of it anyway, telehealth does not necessarily involve the use of an app where someone puts in information data into an app and then sends it to somebody. It doesn't include email. That's not, to my mind, that is not telehealth, because that's not necessarily synchronous. You can type out an email and send it, but the person who reads it won't necessarily read it there and then. They may read it later. So whilst that's my definition of telehealth, I will be drawing in these other technological changes and these other types of helping, these other technological types of helping, and looking at how that fits in with or alongside telehealth. But does it work? Does telehealth work? There is a concern, I think, about telehealth. And it's a concern that I've heard expressed by clinicians as well as by referrers or potential referrers and also by clients. And the concern is it won't be as good as having someone there with me or being with the person. It's said, it can't ever be as good as being in the room, facing someone there and then with them. Part of the reason for that is it's said, well, if you're not there with the person, you're not going to be able to pick up all those cues, their body language that will say so much about them, and you won't be able to build that bond, that therapeutic or working alliance that's needed. Is that right? Well, no, in a word, it's not. So telehealth has been around for a number of years. There are a number of studies that have been conducted into its use. It's a growing area of research. I wouldn't say that the evidence has been brought together completely. There is still some way to go in bringing together all of the evidence. Perhaps that will never happen in one way. But on the evidence that is available, the studies do establish its efficacy. The condition is this. if the telehealth sessions, if the work via telehealth is done properly, then it works. And it, as we'll see in a minute, in the next slide, it's just as good as face-to-face. And there have been these studies that have been conducted in all sorts of domains for young people, as well as children, as well as adults, but also for older people in aged care facilities, in palliative care facilities, in home-based care environments, and also in hospital settings. So there has been a body of research that's being established right now that establishes the efficacy of telehealth. Um, and I'll just draw on a few studies that I'm aware of. There was one in particular that was a meta study, and by that I mean it didn't actually go out and look at a group of people themselves. It investigated other studies. And so it looked at other studies that have been conducted of older people. These other studies were those of people who had, older people who had daily telehealth consultations. And the evidence was that there was an increased sense of connection between the older people being studied, and those around them, and lower levels of isolation and a lower sense of loneliness. And these studies also reported increases in social activities. And in fact, um, um, those benefits of increased social activities in a telehealth method of service delivery, those benefits were over and above the benefits obtained by people who were receiving face-to-face consultations at home. So as I say, there is good evidence to say that what's done properly, telehealth works. And there are some really obvious advantages to telehealth. It enables services to be provided where it might otherwise not be provided. And in the past, that's especially been the case in rural and regional areas where they don't have sufficient members of staff, unfortunately, available. People in those remote areas can still access services via telehealth. And so it reduces costs. It reduces the costs of someone attending a clinician, and it also reduces the cost of the clinician going out to attend the individual. And it also increases accessibility. So there's some really good reasons to support telehealth. So COVID-19. What's happened as a consequence of COVID-19 and telehealth? Well, there has actually been some significant changes, I think, brought about because of COVID-19. With the shutdown, the Commonwealth Government has responded by expanding the Medicare payments to include medical and allied health services being provided via telehealth services. There was some availability for that work before COVID-19. It's now been expanded. It's been broadened and broadened quite considerably. And so now, as a consequence of that, people are receiving services via telehealth that they would not otherwise be receiving because of the shutdown. So it's actually forced, I think, some clinicians to go out and to use this service at the very least. And what I think has happened is this. Firstly, it's increased the awareness of the availability of the service. There is much more discussion now around telehealth and what it can do and what it consists of, etc., etc. Much more discussion of that now than ever before. And also, I think as a consequence of that, um, I have personally noticed anyway, I think this is true, that there has been an increasing acceptance of the use of telehealth as a legitimate mode of service delivery, one that stands on its own. That's not necessarily, a poor cousin of face-to-face service delivery, but is a legitimate method of delivering services in its own right. And of course, along with everyone else, I am very, very hopeful that things will return to what was normal, if you want to use that expression, normal, as soon as possible. But I'm also hoping that this increased awareness and acceptance will continue, and that telehealth will be used more frequently. So on that backdrop, what are some future directions? Well, I think there is one which is very obvious, and that is that it is likely that there will be an increase in the provision of telehealth services. Now, I don't know whether the changes to Medicare payments to broaden the provision of telehealth services, whether that will continue or whether that will only be a temporary change and things will go back to the way they were before in terms of the Medicare payments. Nonetheless, I hope, of course, I hope that the changes that that the government's brought in will be permanent. Regardless of that, I think it's here to stay. And I don't think, well, no, I'll put it positively. I do believe that with the disruption that's happened because of COVID-19, it's enabled a change that was occurring before COVID-19 to pick up momentum and to really embed itself within the aged care sector. So what I mean by that is this. I think before COVID-19, there was some recognition in some quarters at least that telehealth had its place. I think COVID-19 has ramped that up. There's more of an acceptance of that. And I think that that level of acceptance will continue. I also think that it's likely that telehealth will be coupled with other technological uses. And it's the combination of telehealth and technology generally that I think is where the future lies. And I also think that with the acceptance or the increasing acceptance of its use, broader applications will be found for telehealth, and there'll be an increasing evidence base. There'll be more research done into it. It'll be used in other ways to support people. We'll come to those in a moment. There'll be an expansion in the general ways in which telehealth has worked. So what are some of the options? Talking about these over the next few slides. What are some options that are available? So one of them, as I just mentioned a moment ago, is to include technological-based options alongside telehealth. Excuse me. So these are technological options that might be introduced by, for example, using apps. And they enable people to engage in self-paced learning. When I say self-paced learning, I'm talking about learning to do with their physical health and mental health and well-being and health and well-being generally, and how they can maintain that health and how they can even develop that health. Telehealth in combination with other technology, for instance, devices that can be worn, these smart watches, for instance, that allow for continuous health monitoring. Um, that's an area that I think, well, all sorts of possibilities can be thought of there in terms of service delivery for clients using um, a telehealth service that also combines with that type of ongoing daily health monitoring to monitor their ongoing health and progress. And also just continuing monitoring of progress generally, behavior change, particularly um, options that enable the recording of behavior change using apps. Using reminders, simple things like SMS reminders or motivational messages, the ability to provide feedback. Once again, that can be app driven. All of these options that are there to address health behavior change combined with telehealth, they are some options for service delivery in the future, and you don't have to be with the person to do all that. We can be in a city somewhere, and the person receiving the care can be in a remote location, or in some way a location that can't be accessed. Um, there are some real advantages with telehealth, um, with conference calling, and with increased communication between clinicians. Um, I presented a webinar before on client-centered care, and in that webinar, I spoke about the client being the center of care and being the focus of the care. And it's as if um, there you have the older person or the client in the center, and they are surrounded by their carers, and they're surrounded by their care providers, clinicians, and others. And they work together with the client, combined with the older person, to provide a very much client-focused approach. So it's comprehensive, and so it's kind of like a hub and spokes, where you have the older person sitting in the hub and these spokes that go out to the rim, and that's where the carers and the professional people sit, and they're communicating with the older person to provide this comprehensive care, but they're also communicating with each other. And that's important. So there is this network of communication that goes on between clinicians. Now, with telehealth, that comes into its own to enable that type of holistic, whole person care, a care that surrounds the person. So in a very practical sense, for instance, it's possible to set up a video call with an older person, their carer, primary carer, their GP, their occupational therapist, and let's say a psychologist. Um, Everyone can be positioned, situated wherever they happen to be. If they're available at a certain time, though, they can be brought together in this space via telehealth. And it's those sorts of discussions and meetings that can be brought about, which wouldn't otherwise happen. It's going to be very difficult in the kind of like real world, to enable that. Similarly, discussions between carers, discussions between health professionals. Um, Telehealth will facilitate that, and as a consequence of that, increased communication and improvements in care for older people and clients generally. As I mentioned before, this is a series of webinars that have been conducted for Generation Care. And I think in every single webinar I've presented so far, I have spoken about isolation and loneliness. And today is no exception. Isolation and loneliness is a crucial factor to be taken into consideration in the care of older people. It's a significant issue for older people. It's a significant issue now, but it always has been. It's just with COVID-19, it's been exacerbated. Again, telehealth itself provides support and the ability to access older people that's not currently there or is difficult to provide. And it's not the complete answer. Telehealth is not the complete answer to reduce or to cut out isolation and feelings of loneliness, but I think it's part of the solution. Again, telehealth combined with technologies can help. Social networking, those sorts of technology can be used. But another way that telehealth can be applied to help older people with their sense of loneliness and their isolation is via group programs. Group programs that are conducted via telehealth. And there have been a number of studies on groups conducted via telehealth in the, amongst older people. And again, the evidence is that they can work. It enables people to come together. So you can have a group facilitator, a clinician, health professional, whoever it might be, being able to speak with people, let's say, in one aged care facility via telehealth. But it also enables older people at home to be linked to other people at home, to be linked to older people in other situations, or to bring them all, once again, all together into the one environment. Group programs really work, and there's a lot of potential, a lot of scope for, I think, for telehealth in that type of service delivery. You can probably pick up the sense that I'm actually quite interested in this. I would really, this is an area that I think is ripe for use and expansion. And then there's innovation. Technology and innovation, terms that go hand in hand. And I've used just two examples, and there are many, many other examples of how innovation can be used with telehealth and technology. The technological use of gaming, it can be used to promote physical activities. That's already happening. And then technology to assist people with dementia, that's been applied in a really interesting way by Dementia Australia in something that they call the virtual forest. Now that's it's not quite virtual reality, I don't think, but it's a type of environment that is artificial environment that is presented to an older person that they're able to control. So just by waving their hands or by clapping their hands, they can change the seasons. They can go from summer to autumn to, and then jump to spring if they want to. They can change things in the environment. They can cause the flowers to bloom. They can cause the trees to shed their leaves, etc., etc. It's actually really, really interesting. And it's great for people with dementia. Have a look at it if you don't know about it. So how do we see the future? What does the future look like? How might telehealth and technology be used in aged care. As I said before, as I said right at the outset, it's actually quite difficult to precisely foresee the future. Um, who really knows? But we do see these things happening now and in the near future. And the first is, as I said before, I do believe that there is an increasing acceptance of telehealth, and there will be a further increasing acceptance of it. And correspondingly, um, there will be, I do believe, there will be further use of telehealth-based services, even when the current shutdown comes to an end. There's also going to be, I think, a greater use of um, other technologies in conjunction with telehealth. The two will work together. Um, yes, this can also happen face-to-face. Face-to-face work can also bring into it um, technology-based supports, of course. I just think that with telehealth, though, it provides more avenues for that, more opportunities for that. Um, and this is the big one, I think. I think there's going to be increasing accessibility for telehealth services. Um, I've mentioned funding before. I suspect, I believe, I certainly hope, that the funding for telehealth services will continue. There may even be an increase in that funding as people see the benefits of it, so it'll be more likely for there to be increased funding of telehealth services. There's also going to be a reduction, I think, in costs, the costs associated with it, because whilst it, and this is one of its benefits, it does reduce costs, there are nonetheless some inherent costs involved in telehealth. For example, you need a monitor, you need a computer. Um, as we know, though, costs of computers have reduced over the years. There's also the need to spend money in a proper, appropriate platform, the software needed to drive um, the telehealth services. With greater use of the technology, I think those costs will be reduced. And I also think there's going to be improvements in the ease of use. And I touched on that a moment ago with the virtual forest, and when I just briefly described how that's used. And this is already happening where tablets and computers, etc., are being modified. And software is available now, I know, to allow older people to be able to better use the hardware, whether it's because of diminished eyesight or hearing impairment, whether it's because of their ability or inability to use their hands, their fingers, um, um, or even some reductions in their cognitive capacities. Um, Changes are being made now, and I think those changes will continue where it will be easier for people to navigate systems and navigate the use of the hardware to make it easier for people to use. Who knows what that's going to look like in the future? But as I said, it's already been with us. So just some final thoughts. Most definitely, it's here, and it's here to stay. Telehealth is likely to grow. It ain't going to go away. I don't think it's going to remain the same. I think it's going to expand. It's going to grow. Um, it's not a complete answer to everything to all the problems that might exist within aged care or any other sector, but I do think it's part of the solution. Um, um, What we do know, of course, is that there is an aging of the population, and as we go on, so there will be more and more older people in our community, in our society, and there will be a greater need for aged care services to be delivered. And we are going to have to find ways to deliver those services proportionally as the older population expands. Telehealth is one way of doing that. Not the only way, but definitely is one way of doing that. There is going to be, and it's happening now, an increased acceptance of its use and recognition of its utility and of its successful outcomes. The scope of its use is going to grow, especially in conjunction with other technology. So there's going to be more of it. It is going to expand, but it will not replace usual face-to-face contact. That's still going to be part of the mix, most definitely. Perhaps what we'll see is a blending of face-to-face with telehealth services. So, for instance, and I've actually already done this, where you might meet someone face-to-face to start with and have some time together face-to-face and then switch over to a telehealth component, a telehealth way of delivering services, because it's better. I think that blending between face-to-face and telehealth service provision is something that we're going to be seeing more of, along with, as I said before, that use of group work. So that's it for today. I hope that you've found that useful, that was of some use and provided some information for you. So in summary, what have we done today? We've looked at telehealth. I've provided you with at least my definition of telehealth, and we've looked at how it can be used, either it's on its own or as an adjunct to with other technologies. I've mentioned at least once its effectiveness. We've looked at how it's likely to expand, how it has grown and is likely to grow in the future, and how it may hold some, perhaps many, of the answers for future issues. As I said, this is a series of webinars that have been produced by Generation Care, indeed by the Better Health Generation itself. If you want more information about this or any of the other webinars, please send me an email on that email address there on the screen, or visit our website. But for now, thank you for for dialing in, for listening, and I wish you all the very best. Thank you.